The nurses are out here. They are down around 100th Street here off of Madison Avenue. Police have us a little bit further back from the picket line this morning, but they just returned there moments ago. This after there was no negotiation that happened with Mount Sinai yesterday. Montefiore says that they were back at the table with some of the nurses, but still they have more work to do before an agreement can be reached. On day two, there's still no deal.
1, 2, 3, 4. We need nurses, hire more.
The sticking point, staffing and salary. While Mount Sinai's main hospital has agreed to a 19% pay raise for its 3,600 nurses over 3 years, it has yet to satisfy the union's complaints of being overworked and understaffed.
They have ran this operation into the ground and now have 500 plus vacancies.
In fact, safe staffing is the law, which apparently hasn't been enforced.
Today, while these nurses are on the street, you've hired temporary nurses.
That's right.
You've addressed the issue.
While Mount Sinai's diverted ambulances and paused elective surgeries, the private hospital has been forced to fill the shifts on strike with traveling nurses. In a statement, Mount Sinai said the stalemate ignores the progress we have made to attract and hire more nurses despite a global shortage of healthcare workers that's impacting hospitals across the country. Meanwhile, at Montefiore Medical Center, locations in the Bronx, its 3,500 nurses updated us on the picket line last night.
Now, are they taking us seriously?
Yes!
They say there's finally been some movement from the negotiating table after going back and forth since September. Management has offered to add 170 new nursing positions.
Nothing was going on until the nurses walked out.
Yesterday, elected officials joined the picket line and urged the hospitals to come to a fair agreement. Even Governor Kathy Hochul stepping in and asking both sides to go into arbitration.
We're in a tridemic, tripledemic, or whatever you want to call it. We need these nurses back in.
So it's unclear if either side will be back at the negotiating table later on today. We are expecting an update from the nurses union a little bit later on today. However, one point of important news that we want to bring you is that the nurses do not want to hold anyone back from the hospital. If patients have to go inside for care, they say they will not be crossing any picket line. In fact, once they come out, they are welcoming people to join them on the line and show their solidarity as well.